Yippee-ki-yay.
Oh, wait, Bob.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Because we are the most famous physical therapists on the internet.
Well, in our opinion, of course, Bob.
So we're going to discuss calf pain today. You must know this if you're having calf pain. Is it a muscle strain? Is it a clot? Or is it, we even have another thing it possibly could be.
Compartment syndrome.
Right. So we're going to go over some of the possible signs of each and hopefully help you discern. But at some point, you may have to go into the doctor to actually get this all figured out.
You'll have to see a professional, particularly for blood clot. But we're going to go over some things that they're going to look for and how they look for it as well. So we're going to start out with a muscle strain, though. But even before that, Bob, I'm going to segue into your...
That's right. If you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, go over to Facebook and like us, because when you do, we give out cool vibes to you. And I mean, we're putting out the vibe.
Yeah.
Dumb and Dumber, baby. Putting out the vibe.
So, yeah, that's a movie for older people. You know, it's been about 15 years
No, the older
ago.
people know it. It's probably the younger people that don't know it.
Right. That's what I mean. Older people. Well, one way or another, we're not dumb and dumber. We don't think. Carry on, Bob.
Okay, so you got to carry on.
Oh, this is my show.
It's your show.
Okay, so when you have calf pain, very common. The most common cause is a strain, a muscle strain,
or a slight tear.
Right.
You know.
And the activity is usually you know what happened. Maybe you're out playing softball and you took off running from first base and you felt that sharp pain. You're jump roping, maybe running longer distances.
Very common in tennis players.
Sure,
very common.
Right. Sometimes you could have a muscle strain and you don't really know where it came from, but you know, it may be going up the stairs aggressively when you weren't thinking about it.
Yeah, it's creeped up on you.
Right. So one way or another, the location. I'm going to show my leg today, Bob.
All right, go ahead.
The location is in typically the muscle belly, although if it's in the tendon, you know, it may be lower down in here or right in the tendon itself.
Then you might have a tendonitis.
Right, so that's a little bit different than...
But it does tend to be right in the middle here, basically. That's
oftentimes
where it tends to happen.
The gastroc, this bump here, and the soleus muscle here, oftentimes right on that borderline.
Sure.
Sometimes in a little deeper. It does vary. It's oftentimes point tender if you're pushing the muscle.
You can find the spot that it actually hurts.
Be the size of a quarter, a little bigger than that. It's like, oh, there's the spot. That's pretty typical. When you stretch it or dorsiflex, oftentimes that may irritate it, particularly if you're going a little more aggressively.
And you know, actually, and I know you're going to mention some of the treatments, Brad, but one of the treatments too is actually to wear a little heel wedge for a while.
Oh, sure.
And that takes some of the stress off the calf. So you could take like a 1/2-inch heel wedge, put it in your shoe, which you can buy at Dr. Scholl's or something like that.
Sure, you can get them at the store.
And it'll take some of the stress off the calf while it's healing.
Right. If you do that, you should put one under each foot. Otherwise, you have one leg essentially shorter than the other. But if you do that also, you should notice that it immediately feels better. And it's a short-term thing. You're not going to wear these in your feet.
No, because you don't want the heel to tighten up on you.
Precisely.
The heel cord to tighten up.
Other treatments for a muscle strain, you're going to use cold packs initially when it's tender and sore.
24 to 48 hours generally.
Right. You can do some gentle stretching. You know, you just injured it. You don't want to stretch it aggressively and re-injure it. So maybe some gentle range of motion and stretching initially, particularly. Ibuprofen if you want to do some inflammatory meds over the counter. And then, you know, after it's starting to heal, you may get into some soft tissue work, either some cross friction mobilization or the 6-inch roller where you're going to work on that. We don't have time to get into these treatments.
Yeah, we have a whole video on this. So if you type in Bob and Brad and put in calf injury, I mean, it'll pop up. And
I think we've even got more than one video.
I do think we do. Yes.
Same people though.
Yeah.
Go
ahead.
Typically, a calf strain is going to heal within, 2 weeks is probably getting, pretty good. It may go up to 6 weeks depending on how aggressive you are. If you, go out and run or do something to irritate it again.
They tend to respond well. I mean,
sure.
I mean, and 2 weeks is probably if it's a new injury and you do the cross fiber right away. 6 weeks might be more for a chronic problem.
Sure.
So,
precisely.
But it should heal. I mean.
Oh yeah.
So.
Now the next one we're going to go to is compartment syndrome,
Now, this is a more of a rare event.
Right. But you know, it's not like it's
Never happens.
right.
Right.
It's out there, and you know, you can Google it and look it up. I was just talking to a podiatrist who works with this, and she actually does surgery on it.
Sure.
Last week, and I had a chance to talk to her about it. But you have actually 4 compartments in your calf, and each compartment has muscles in it. And when you exercise, those compartments start to fill up with blood because the muscles need the blood, but the blood doesn't exit the way it's supposed to. So
in compartment syndrome. Normally it does, actually.
right, precise, yep. So what happens is blood's going in because you're exercised, the blood's not going out for whatever reason, and the compartment starts to fill up and gets too much pressure, you get too much lactic acid in there, pain starts, and typical symptoms are once you start an activity, within a short time, you get a real sharp pain, but then when you stop, the pressure goes down and it feels better. You do your activity again, sharp pain, stop. If it's serious, you'll see some swelling. You may have numbness, tingling down in your foot because the nerve and the blood flow is being compromised.
Yep.
Right. So if you're getting those kind of symptoms, neurological symptoms, then you got to go in.
I think you're going to see this quite often in runners. I mean, this type of, that's where you might see it, is in a runner or a biker.
Right.
Because you're using the calf a lot.
Sure.
You know, when I was running when I was younger, I'd get a little numbness there.
Yeah.
And I think it was just a mild form of compartment syndrome.
Another time you get compartment syndrome is after trauma. If the leg gets broken or a crush syndrome where your leg got smushed, that can irritate and start the blood flow problems, which can lead to compartment syndrome.
So the compartments are made out of fascia, and the muscles are inside the fascia, and they form again kind of a tube almost around the muscle. And again, they can only expand so much. So if the muscles expand from the blood flow, it's compromising on the blood and the nerves.
Right. That fascia is tough. It's not going to expand like a balloon.
Right. So
as far as treatment on this, particularly if it's serious, it's a simple surgery. The podiatrist, Maggie, she said it's simple. Once they prepare everything, it's 15 minutes.
Sure.
They go in, it's an incision, they open up the compartment, releases the pressure. Naturally, it has to heal up, but it's all soft tissue. So
I wouldn't recommend doing it yourself.
No.
Don't take the little butcher knife and.
Well, that's what I asked her. I said, "This is so simple, maybe."
Yeah. Can we do it?
Yeah, but she said probably not.
No.
Yeah, and finally, the last but not least, and probably the most serious for sure.
Most serious and probably the second most common.
Sure.
I would say, wouldn't you?
Yeah.
I mean, I've seen probably 5 cases of this.
Okay, and what we're talking about is a DVT or a blood clot.
Deep vein thrombosis is the professional term.
Right, the layperson calls it a blood clot, and that can happen here. Oftentimes, it's a little closer to the knee. You can get these blood clots throughout the body.
Sure, anywhere.
But this is a common location for them.
The worry is that the blood clot could dislodge and go up into your lungs. So, I mean, there was a reporter years ago. Do you remember we discussed this before? It was during the Iraq War.
Oh, right. Mm-hmm.
He actually was killed because he was driving around in the tanks so long, and he was inactive, and he developed a blood clot, and it went up to his lungs and killed him.
Right. So far as causes, and his reason he got the blood clot because he was sitting still for so long,
for hours at a time.
Right.
And that's why, you know, the concern is on airplanes. That's why we tell you when you're on an airplane to go ahead and do ankle pumps because you're sitting still. And I think there's something to do with the air pressure too, isn't it, on airplanes?
You know, that I'm not sure. But as far as the simple thing is getting some exercise, you get these muscles working to keep the circulation moving.
You're more at risk after surgery, obviously.
Surgery or maybe an injury that things are healing down here. If you have a lot of swelling in your leg for whatever reason, a little more concerned about it.
If you've suddenly become more sedentary for a reason, and maybe because of an injury or something, then you could be more at risk.
Right. So, normally you're active. You broke a leg or whatever, and you're sitting around for days on end because of the injury, waiting for it to heal. That's always a concern. As far as symptoms, and this is what I do. You know, in the clinic, I'll squeeze. I'll feel for temperature, tenderness.
Yeah.
When you squeeze an area that's got a deep vein thrombosis, it's pretty tender.
Yes, it is.
And then we stretch the ankle. There's a test called the Holman sign. We're not going to go through it in detail, but you palpate, you stretch the muscle, you check for temperature. And the thing is, if it's positive in the clinic, chances of it being a false positive are pretty high.
Yeah.
In other words, 50% of the time, it may be a positive Holman sign saying, oh, it looks like a deep vein thrombosis. And you take it in and do the confirmation test, which is an ultrasound, which is done in in the hospital or where they have an ultrasound.
Right.
And that's going to tell you for sure.
Right. And
So I don't recommend you try to diagnose yourself with either compartment syndrome or blood clot. You need a professional to do it.
Yeah, and that's been my experience. I probably have had 10 people sent in to check to see whether or not they've had a blood clot.
Sure.
And it's been 5 or 6 that did.
Right.
I mean,
so it goes along with the study.
It
that
goes
I read,
along with the study.
Right around 50%. So.
And quite often, what I'll do too is like I'll squeeze this side and I'll squeeze the other side and
Compare.
And if they both hurt, they're like, oh yeah, they're always tender to me.
Right.
Usually, so we take a lot of things into consideration.
Right.
When we're
and that's why it's something you need to work with, day after day, year after year, to really get a good feel for both compartment syndrome and a blood clot or DVT. So I hope this helps you understand a little bit about calf pain and some of the more common reasons for it, and then what to do about it.
Yeah, watch our other video if you do need help with that calf strain. So
right.
Thanks everybody for watching.